Thank you everyone for joining. I'm going to hand it over to Carey Peña.
Thank you so much, Molly, and thanks to all of you who are jumping into this important discussion today. My name is Carey Peña, and I'm a journalist based here in Phoenix. I know I have a lot of my media friends who are on the call with us today. This is the Female Voices of Cancer webinar brought to you by the City of Hope and TGen, two organizations that I have worked closely with doing storytelling. And also, just to give you a little bit of background about myself, I worked here at 3TV, and I believe one of our executives from 3TV and CBS is on the line with us today. But I've done a lot of reporting in this space, and I care deeply about bringing these messages to the public. So specifically today, we are talking about rising cancer rates among younger women, and this has become an urgent health challenge. City of Hope, one of the country's leading cancer institutes, is joining with the American Cancer Society, TGen, other partners in a call to action on three key areas. And I want to just outline this, and then I'll tell you about the esteemed panel we have on the line today. We're talking about a wider availability of risk assessments, and what does that mean? A national standard for supportive care. What does that mean? And also, I'm really excited to bring more of the highlight here in the spotlight to research specific to this particular patient group. So we will be speaking with all of our experts here. We have Dr. Segun Shrestha on the line with us today, Dr. Adam Karyevsky. We have a patient who is a very brave warrior here to share a little bit about her story, RP Hamilton, and also a lady who I have had the good fortune to interview previously from TGen, Bethany Davis, who is a PhD and incredible research assistant professor at TGen. As we open this up to each of our panelists, I would love to, I know you all have long bios. I would love to, when I direct the questions to you for our audience, I'd love for you to start out by giving a little bit of background about your work and your area of expertise so that we can frame the conversation appropriately. And Dr. Shrestha, I'd like to turn it over first to you.
Good afternoon. I'm really excited to be a part of this conversation and what we are going to discuss. And it's very dear to my heart about, raising consciousness about cancer in younger women. Like I said, I've been in practice for over 20 years, and I've been with the organization, and I'm the chief of medical oncology here. I do treat different forms of cancer, but I've done a lot of breast cancer, lung cancer, and other varieties of cancer over a period of time. Just a personal thing, almost exactly a year back, actually, April 30th, one of my nieces was 39 years old with 3-year-old twin boys, she's a physician, and called me and said that she was diagnosed with stage 2 triple negative breast cancer. And just a week later, another niece who is 34 years old, was supposed to get married in July, got diagnosed with a poor prognostic factor, acute myeloid leukemia. So both were young women with, less than 40 years of age, without any kind of predisposing factor. Has really, it disrupted the whole family, and me being an oncologist trying to be a liaison between the rest of the family was very hard. So this is very dear to me of what we are going to talk further.
Dr. Shrestha, I'd like to just delve in a little bit more as we frame the conversation, and then move on to some of our other panelists here. And by the way, to everyone who's joining, we want this to be a conversation. So if anyone, wants to jump in at any point, please feel free to do so. But I'd like to start by asking you, why are these cancer rates amongst younger women rising so much?
This is a very good question where I don't think so we have all the answers right now. But over the last several years, like, the rate of cancer in women was almost 50-50 between young women and men. But in the last few years, the cancer diagnosis and the rate has increased to almost 82% higher than in men. And the reality is that many women are navigating a cancer landscape that fails to address their unique needs. And today we are here to call a bold changes in how we can treat, have more research and talk more about cancer among younger women. But I don't think so. We have all the answers to say why there is an increase. Most likely it's, the environmental factors, the lifestyle changes, and how I think women are having pregnancies later in life as compared to how it used to be before. So a lot of things are coming into play where we don't have all the answers right now.
Why do you think a conversation like this and City of Hope and TGen is really trying to put this out nationally? And by the way, my team is here filming this. We're going to be publicizing this, and a lot of media friends are going to be doing stories on this. Do you think this is an urgent need to get this messaging out to the public?
Yes, definitely. This is a big change we need to make in how we have the healthcare system in addressing all the cancers, especially in younger patients. Before, there is a big need for making those changes, and places like ours where we have the advanced treatment centers like in City of Hope, trying to take those steps and make that advancement is very important. Also, we are fortunate over here in Phoenix to have the research collaboration with TGen. They are bringing expediting research from bench to bedside where the patient need it most. Also, the new therapies which are coming along and allowing more people with cancer to live longer. And we are becoming progressively more successful each year with all the targeted therapies, immunotherapies, which have definitely been a game changer, giving us better results and better prognosis for all our patients. Also, before, most of the treatments or the cancer rates were higher in older patients. So historically, what has it been is the research is more focused towards older patients, and it has been the support we provide are generally tailored to the older patients that historically were most impacted by cancer. Therefore, definitely we need to make that change, and with the significant disparity in cancer rates we are seeing with higher rates in young women, we need to rethink our approach to responding to cancers in younger women.
And we're very fortunate to have RP on the line standing by here, and it's going to share her inspirational story in just a moment. But I have been monitoring some of the questions as I've put word out there that we're doing this today. Dr. Shrestha, if you could just very quickly here off the top, talk about, if you can, what is the importance of women, younger women, knowing the risk, and then not just knowing it, understanding what do you do? How do you try to protect yourself in a preventative fashion?
Okay. So I'm proud to say that City of Hope is joining with the American Cancer Society and other partners to call for changes. Mainly three main changes we are trying to do is, trying to we are calling for wider availability of risk assessments that can help women understand their risk for early occurrence of cancer. In terms of genetic testing, again, several years back, I'm talking about decades back, to do a genetic testing was very expensive and insurance didn't cover. But now things have definitely changed, and there are more wider options of doing genetic testing for these patients, especially if we have a good family history taken by either the primary care or any healthcare providers, the gynecologist. If they have a significant history, definitely we are sending these patients to genetic counselors, which is available in City of Hope. Also, the importance of telling patients about lifestyle factors, changing their diet, being mindful of doing exercises, and also asking for doing the screening guidelines, because there are so many changes in the screening guidelines that when patients think that, okay, I cannot have a certain kind of testing done at certain age, we would want the patients to go and talk to their providers to see what are the options there. Also, we want to prioritize research for younger populations, especially in women. We are contributing to the science at City of Hope. Women under 40 still remain significantly underrepresented in the clinical trials. So a gap that limits the development of age-specific treatments and personalized care strategies. We are working better on that. There is a trial we have called the phase 2 I-SPY trial, which is for neoadjuvant for breast, and it's more focused on treating them with the right way, so the side effects are less long-term. Also, like we do have a national standard for healthcare providers and insurers to provide more supportive services for cancer patients. As we know, for younger patients, once they have treatment done, I mean, they have to face the long-term side effects for decades and decades. So it's very important for us to support them for that. And every patient who is at the childbearing age, we make sure they have the consultation with fertility experts. So we are not holding them from getting that opportunity of having ovum banking and making sure they can still have children after they have treatment done.
Thank you so much for setting the stage there. And I know we're so lucky to have TGen on with us today as part of this collaborative effort. Arpi, I want to bring you in now to share a little bit about your story. And thank you so much for being a brave warrior, for speaking out. If you would just tell the audience about sort of your path when you were diagnosed and what you're doing now.
Yes, thank you so much for having me here today. I'm going to take you guys back a little bit. It started in 2009, and my mother fought a very short battle with cancer. We never did know what type of cancer she had. By the time they found it, it was just too late. So I was working in real estate at the time, and I just needed a change. I wanted to be a part of finding a cure. I wanted to do something to give back, to honor my mom. And so I got a job at City of Hope. And I worked in many different capacities. And 7 years in, I found myself on the other side of the table. And as a young woman, I was 38 at the time. This was in late 2016. Well, early 2016, excuse me. And I didn't feel heard. I had gone to my gynecologist. I presented with a lump. I explained to them that I wasn't feeling well. I exercised regularly. I drank a lot of water. However, I did drink a lot of caffeine. No family history. All of what I knew about cancer and what my risks were, this was not matching up, but something inside of me told me to get checked. I could not get my doctor to write me a referral for a mammogram. I went in April of 2016. I went in September of 2016, begging for them to do a mammogram. Finally, in December of 2016, I presented with a very large lump. I had some pain in my underarm, a few other symptoms. And so I was able to get that referral and get to City of Hope right away. And I will tell you, within 48 hours, I had a diagnosis of stage 3 triple negative breast cancer. And if you know anything about triple negative breast cancer, it does not have a good prognosis. Many women, I think it's at like a 20% chance that they'll even survive 5 years. Many women go stage 4 very quickly. And so based on the data that I had at my fingertips, I knew that I was going to do everything that I could. I didn't have a family history, like I said. My mom's cancer was not breast. It was not genetic, and neither was mine. All of my genetic testing came back completely negative for any BRCA mutations. And really, there was no reason why I would present with this type of cancer. Seemingly, I was a 38-year-old Caucasian woman, not heavy set. I was pretty fit. So it was very confusing. I did undergo 6 high-dose rounds of ACT chemotherapy treatment. I lost my hair, which was very emotional for a woman. A lot of our identity is wrapped up in the way we look. And so it's interesting that when I was diagnosed, the very first thought that came to my mind was, please, I don't want to lose my hair. In the end, that was very minor compared to everything else that I experienced through treatment. And I did end up having a mastectomy shortly after chemotherapy. And I was healthy enough, thank God, to be able to go right to immediate reconstruction, which for a woman to go into surgery with her breasts and to come out with her breasts, I felt very lucky for that. And that was followed by 30 rounds of radiation. So then in August, just 8 short months after being diagnosed, 8 short months after, they didn't know if I would survive without treatment. Had I had gone another 8 months, I don't know where I would have been. I was declared cancer-free in August of 2017. And I want to just kind of say a few things about the care that I received at City of Hope and how important it is as a young woman who had never really had any type of medical treatment done. I hadn't even had a cavity filled. And so City of Hope really, really kind of rallied around me. The group of people that they hire, this is world-class talent, you guys. This is compassionate cancer care. And my providers, from my medical oncologist all the way to my interventional radiologist, treated me like a human being. I wasn't just another patient to them. Sure, I was an employee, but many of them didn't know that. And that supportive care, the supportive services that this hospital has is second to none. And treating me like a human being and treating my entire body and not just my cancer was what saved my life, truly. And so my message to other young women is to fight for your voice to be heard. This is not an old lady's disease anymore. Like Dr. Shrestha said, I work here at City of Hope, and I have the privilege of sharing space with patients every day. And we are seeing more and more young women, women that are, prenatal, women that are pregnant are discovering this. And there's got to be a way, a non-toxic way to be able to screen these women. We know that screening saves lives, right? Screenings catches cancer early and it can save your life. But if we can't screen them until they're 40 years old. So thank you for letting me share my story.
Well, it's everything you said is so powerful, and I'm so very sorry about the loss of your mother. I wanted to, if you would, because one of the things that's really important to me as a journalist when I do the reporting on folks who've walked through the cancer journey, whether it's themselves or watching a loved one, if you could just touch on the psychological aspects of that. As we all go about our lives, we think we're doing well. And in your case, you were extremely healthy, all of these things. And suddenly this just knocks you sideways.
Yeah, I can tell you, I was living my life. I was working at City of Hope. I was a full-time student getting my degree. I was a young married mother of 2, so I still had 2 children at home. My husband was an amazing caregiver to me. And, honestly, through treatment, mentally, I was okay because I was doing something. I was under the care of providers. I was being checked regularly. There was nothing really for me to be anxious about other than my surgery. It was after treatment, truly, that my life, I felt, fell apart. I couldn't make sense of what my body had just gone through. My body looked different. It felt different. I'll tell you, in young women and young men too, survivorship needs to be a bigger focus for cancer patients coming out of treatment. I'll be honest, intimacy when you're dealing with breast cancer or even colon cancer, any cancer, but my body had gone through a change. And so being intimate, was really difficult. And my husband and I were not intimate the entire time I was in treatment because his focus was saving my life and my focus was saving my life. Coming out of treatment, however, he wants to be sensitive and gentle. I don't want to hurt her. I want to protect her. And in my head, I'm over here saying, he's disgusted by my body and he doesn't want to touch me and he doesn't want to look at me. And so going through therapy together, coming out of treatment was so important. And I see a lot of young people today, and I talk to a lot of young survivors and patients, and that is one subject that nobody wants to talk about. And it's so important. It took me 7 years to really mentally get myself in a place where I feel like I'm healthy again. And lots of therapy, lots of rehab. But I finally feel like I've turned a corner, and the way I've healed is by giving back and helping others. That truly is the most important thing to me.
Well, this movement is the female voices of cancer, and you speaking so honestly is really important because the things that are unsaid need to be said. And I just think it's so brave for you to be able to come on this broadcast and share that part. Dr. Karyevsky, I'd like to bring you in here. I do want to have you introduce yourself to the audience, if you'd be so kind. And then if you would start by reacting to what RP said, that she did not feel heard.
Well, thank you for having me. It's an honor to be here. My name is Adam Karyevsky. I'm a naturopathic physician and licensed acupuncturist. I have a specialty in oncology through the Naturopathic Association and Board. I've been working at City of Hope for over 16 years and practicing over 25 now. I'm also the medical director of integrative oncology here at City of Hope in Phoenix. I'm sorry, your question about RP.
Yeah, just starting with what the quote that she said along the way was that she did not feel heard. And a lot of women, framing it for this conversation, doctor, a lot of women share that sentiment.
Yeah, I would say being diagnosed with cancer is one of the most overwhelming situations for anybody, or could be one of the most stressful. And there's so many thoughts going through a patient's mind, I'm sure. And for RP, I mean, I hear this from other patients as well, where they feel like they're a number. They feel like they're just going through the motions through other places where they're being evaluated or treated. I didn't know, but for RP to have to beg to get a mammogram is just mind-boggling to me as far as how that could even happen if a physician felt a lump. Or examine a patient. So screening is so important, and I'm on the opinion of overly screening, just making sure that you're looking at every part of the body to make sure there's no worry or concern, and to be proactive in going to the doctor when you're healthy to prevent disease and prevent these kind of situations happening. So unfortunately, I hear this from a lot of patients of not being heard. Here at City of Hope, we have such a fantastic team of professionals and physicians and support staff that really are top line of care, and really take the time to listen to patients and make sure their answers, their questions are answered as best as we can.
So I wonder here, since we do have some media friends on the line, and we're talking about the fact that there is urgent need here, what message do you want to share from your lens about what you're doing that you think needs to be paid attention to, that could help women potentially in a preventative fashion, or to get the help they need faster, which obviously is going to affect everything in terms of their rates of survival?
Well, as a naturopathic physician and dealing with integrative oncology, I am very, very proactive in talking with patients about lifestyle, about diet, about what they can do to prevent recurrence, and obviously what they can do throughout their cancer journey. So under the umbrella of supportive care, which is an area that I think really needs to be expanded throughout the country for all patients. It's a comprehensive evidence-based approach that aims really to help keep patients on track with their treatment, try to prevent them falling off or setbacks from their treatment, and really taking care for all the people affected by cancer, not just the patients, but their entire families. So it's really imperative for the entire patients and family structure to have quality supportive care, that they have those services. So supportive care covers the entire continuum through diagnosis, treatment, and survivorship, and really helps emotionally, helps physical health, and has a lot of different specialists that have expertise in their fields to be able to address all their questions.
And I just have one more question on this. And Dr. Davis, thank you for your patience. I'm going to get to you here and talk about research in just a moment. But on the subject of supportive care, Dr. Karievsky, I was reading some of the pre-production notes. I think this is really important to draw out, especially in light of what RP just shared. So here from your notes, from the City of Hope notes that I received, for younger patients, supportive cancer care, especially important because it addresses unique concerns such as job reentry, body image, relationships, dealing with the emotional stress of potential recurrence, fertility issues. Can you just touch on that? Because I think that that is really the headline to me.
Well, again, when you have a cancer diagnosis, it's overwhelming and it affects the patients and their family in multiple ways. So when you're talking about whatever the cancer diagnosis is, there's so much worry and overwhelmed with treatment, with what the side effects may be, as well as how it affects a family dynamic financially, intimately with partners, the family structure with children, family planning for future. There's so many crucial areas that need to be talked about in an open and honest way. And these are areas that, at City of Hope, we are always addressing with patients, and we have to make it a priority for every patient across the country.
How, as a patient, would I advocate for myself if I don't know that I'm getting supportive care?
Well, there must, there's certainly online support and information online, but really raising your hand and asking for these services wherever they're being treated is vitally important, and to take an active role in their care. This should not be just at certain centers. This should be nationwide as a availability to every patient. There's so many questions and so many needs for every patient, and they're individual, but they all also have many similarities as well. So patients do need to take an active role in their care and not just sit back and just be told. Obviously, a physician will direct their treatment, but they do need to ask for other support depending upon their situations as well.
Doctor,
We
Sorry,
do,
go ahead.
we do take an active role to ask these patients all these subjects ahead of time or during their treatment to make sure they're being addressed at City of Hope.
Thank you so much, Doctor. And Dr. Davis, I'm going to move over to you now to talk about the research aspect. And I've had the good fortune to interview you previously and to do a lot of work alongside TGen, which is a research facility here based in Phoenix, but that's doing incredible work that has impact really worldwide. So within the context of the conversation today, female voices of cancer and these rates coming in at a younger and younger age for women, from a research perspective, Dr. Davis, can you talk about what are some of the drivers to this?
No, that's a phenomenal question. Just to backtrack here. Hi, everyone. I'm Bethany Davis. I'm an enrolled member of Turtle Band of Chippewa Indians from North Dakota. I got my PhD in biochemistry and molecular biology, focusing on environmental toxicities and their role in the development and driving the onset of various cancer types, specifically kidney cancer. Early on in my, when I was in graduate school, I was looking for, postdocs. So it's my next step. What's going to be my next step after I graduate? And I came across TGen all the way in North Dakota, of all places, right? And I started looking into what TGen was about. And I was really amazed by the research that was coming out of TGen. And I had to figure out, how can I be involved? So I was given a postdoc here in 2018, and I've never left, and I choose not to because of all the groundbreaking work that we are doing here at TGen, and it's amazing to just be part of it and seeing the differences it's making in individuals, and that's something to be amazed, to be proud of and to be a part of. And so when we think about the research perspective of early onset cancer and what's actually driving it, we are seeing a lot of differences between early onset and late onset cancers. And so early onset is typically any cancer diagnosis before the age of 50. And so one area that I wanted to highlight are just some of the mutational landscapes. And so typically, or not typically, but breast cancer isn't the only cancer that affects women at, under the age of 50. We are also seeing, colorectal, we are seeing liver, we're also seeing kidney. And genomically, what we are seeing is that these early onset cancers have fewer somatic mutations overall, but what they do exhibit are larger or higher prevalence of specific mutations, such as TP53 mutations that's associated with breast cancer, or mismatch repair deficiencies that's associated with colorectal cancer. There's also supporting evidence to show that there's a germline predisposition that is also playing a role in that's more prominent in early onset cancers, such as mutations in the BRCA1 and BRCA2, various Lynch syndrome genes. All of this could increase the risk for early onset cancer. However, there are some cases where we are not seeing those germline mutations as well. And so when we look collectively at the field of genomic research, historically, it's been focused on cancer in later stages or late age and of individuals of European ancestry. And so when I say ancestry, I mean genetically related. And so when we look at the demographics here in Arizona, we are seeing an early rise or an early onset of cancer in a wide, diverse populations, specifically women. Therefore, we need to expand our research and clinical studies to include these individuals to really understand this diverse population and to really hone into what is actually causing or driving the onset of this cancer. So just for an example, kidney cancer is one of the top 5 cancers in Arizonians. Typically, kidney cancer isn't diagnosed until 65 to 74 years of age. However, in some tribal communities, we're actually seeing it being diagnosed as early as 40. That's a big difference. That's 25 years of difference between individuals that live in the same geographical area. So you start to question yourself, what is actually causing that? And so if we start to develop these relationships and include them in genomic research, we can then pinpoint what is actually causing or leading to the development of these early onset cancers that we are seeing on a rise in Arizona populations. And then one other aspect of this is the treatment part. And so we all tied into this. Precision medicine is going to be key to really tackle cancer. And so all the information that we get from the research side, we then translate it to the clinical side, to the bedside. This patient, again, has, a deficiency or a mutation in MMR, so they might respond really well to immune checkpoint inhibitors, for an example. So all of this information has to be really tied together to really help improve the personalized medicine for each individual and not just a group and automatically just assume every person fits in that group. So it basically takes away our guesswork and it's going to help us tackle cancer early on.
Thank you so much. So many important things that you just said there. And I want to be cognizant and respectful of time. We have about 9 minutes. There's so much to get to here. So I have one follow-up question for you. And then Dr. Shrestha, I want to go over to you to touch on the colorectal cancer, because I just read an article about the skyrocketing rates of that. So I'm going to go there next. But first, I wonder, Bethany, when we talk about, you mentioned the toxicity. So that's obviously a hot topic. Okay. I try to eat really healthy. I try to do everything in my power to balance my diet, to do all the things. But how do I know? What does that mean?
Right. In reality, you can do all the necessary steps, the necessary precautionary steps to prevent exposures, but they're found naturally in our environment. And so for instance, Arizona is a hotspot for arsenic and lead and aflatoxin. Well, individuals that are farmers, for instance, grow that food naturally. And so we as consumers then eat that food and ingest it that way. And even though, people talk about, farmers aren't using fertilizers or pesticides that have all these heavy metal toxicities, well, they're not. They might reduce the exposure due to the type of pesticides or fertilizers that they're using. However, previous years they have used it, so it's still deposited in the environment that we are exposed to. And so when we look at it long term, it's going to take several generations for those toxicants to be effectively removed from the environment. And so agencies like EPA is going to be really important to measure the amount of those toxicants that are found and relay that back to the public to know if there's a hot spot or and where and what to avoid.
Thank you so much for that. And Dr. Shrestha, I want to go to you to talk about your level of concern about the rising rates of the cancer, again, framing it within this conversation here. Obviously, anytime a patient walks into your office who has cancer, any type, is concerning. I have read a substantial amount of credible articles about the growing rates of colorectal cancer, specifically with younger women as well. Are you concerned about that? Hang on just 1 second. Molly, I think she might be on mute. Just let's bring her up so I can hear what she's saying here. I think I have you back now. Try again. You know what? Let me move over just for a second while we try to troubleshoot that. Dr. Karyevsky, let me ask you sort of the same question, the patients that are coming in to see you and your main concerns right now.
All right, let me unmute myself. You hear me now?
Yes, thank you.
Yeah, we are seeing a lot more, I've been here at City Hall for over 16 years, and the population of younger population of patients is increasing. And it is concerning recently in the literature about and the rising rate of colorectal cancer in patients and women at an earlier age. So we are seeing that, and I think this is still being worked out as far as why that is. But it is a change that I'm seeing here. What was your question for me, though? I'm sorry.
Oh, that was great. That was basically that answered what I was asking about. And now I want to give everyone a moment to give their final words, what you want the audience to take away from this discussion. And if we're giving a call to action, what do you want that to be? Dr. Karyevsky, I'll start with you.
Again, I work with integrative oncology and supportive care. So my call would be for any patient going through active treatment or through treatment or after treatment and survivorship to really focus on seeking out supportive care, and then seeking out someone to discuss lifestyle, diet management to try to help prevent recurrence. Eating for women who have diagnosed and they eat a healthy, more plant-based Mediterranean diet. They moderate their alcohol intake, they control their weight, and they exercise. I usually recommend exercising at least 150 minutes per week. These are really powerful risk reduction choices they can make, and can reduce their risk of recurrence by up to 20 to 30%, depending upon cancer type and individual adherence to those lifestyle changes. So I'm always talking to patients about trying to help them through their treatment journey and helping them to try to prevent recurrence.
Thank you for all the work that you're doing there at City of Hope. And Dr. Davis, I'll go to you next. Your final words, a call to action. If someone's listening to this now or later, or our friends from the media, what do you want them to know? What is urgent in your mind as a takeaway?
Ask questions. That's the biggest thing. It never hurts to ask, whether it's your primary caregiver, family members, understanding the risks and being your own advocate, honestly, is what it's going to come down to. Getting those questions, again, whether it's going to your doctor, family, that helps you with the next step. You're diagnosed with cancer, participating in the research so we can identify what actually is causing it, and so we can properly treat it. We also have, new ways that are coming out to for early diagnostics of cancer, so we can catch it much earlier. So all of that participation is going to be crucial, not only for you, but for your neighbor, for everyone in the same field, to really help us fight cancer.
And the research you're doing at TGen, while some of these rates we're talking about are discouraging and we're concerned about that, on the other side of it, you are doing tremendous work at TGen and making a lot of progress. So thank you so much for participating in this discussion today. Dr. Shrestha, let's see if we have your mic back, and hopefully we can get a final word from you. And then Arpi, I'm going to leave it to you to close things out. Dr. Shrestha?
Can you hear me now?
Yes, ma'am. Go ahead.
Oh, you can?
Yes.
Okay. So the bottom line, the takeaway from this is we want to empower every woman who is less than 50 to take charge of their cancer risk. And by them knowing their risk can help a woman understand if they need screening at a younger age, so they can, the same message from what I heard from everyone is raising the hand, going to their primary care, their gynecologist. If they have any concerns, don't sit around, just go and ask for help, so that the earlier help they get, the better outcome, earlier diagnosis, better prognosis. Those are the important things, because, as we said, that more and more women less than 50 years of age are being diagnosed with cancer, any type of cancer. And when we are diagnosing them later than earlier, then obviously the prognosis is not good.
Thank you for all of your work, and we really appreciate you. And finally, Arpi, I'm going to leave it with you because you've walked this journey. You're courageously telling your story. What message do you want to send out there? Maybe it's someone who's walking through the battle today, or is afraid of, just in general, it's fear, right? We hear all of this about cancer. So what message do you want to leave with the audience?
I think for women who have yet to be diagnosed and women who are currently treating, my advice would be to seek out support. Cancer can be really isolating. It can make you feel really alone. Seek out support. There's programs here at City of Hope, like the Cancer Fighters Program, where we provide educational resources and supportive care for anybody going through cancer. And I always say too, we don't always know all of our options, and there are many, 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 hundreds of options available to us. So when you go to one doctor and they tell you that this is the only form of treatment that's available to you, seek out a second opinion, seek out a third and a fourth. And I always tell my friends, it's interesting because once you're diagnosed, it seems that other people come to you and say, where do I go? What do I do? City of Hope is a specialty hospital. If you were to break a bone, you'd go to a bone specialist, right? So doesn't it make sense to go to a cancer specialty hospital that everything is encompassed under one roof? You have an entire care team to take care of you. So I just echo everything that the panelists said. Ask questions and speak up for yourself.
Thank you again for telling your story and speaking out and advocating for others. As a journalist, I can say that, when people have gone through terrible things and we've documented them, so many find strength in being able to share the story, to empower themselves, and also share what they've learned to help others. So thank you so much for that. And to all of you who are here with us today, our friends from the media and others who might watch this at a later time, we appreciate you. On behalf of TGen and City of Hope, my name is Carey Peña. Thank you so very much for joining us for this discussion.